within the first 2 weeks of going carnivore, I remember looking in the mirror one day and thinking, wow, I'm getting more and more abs. Obviously, I was losing visceral fat. It's much easier. So I could do more push-ups within a week or two of carnivore than I've ever done in my life. I just found that my strength's a lot better. I've been able to build muscle. And then my other main difference has been, well, two others. The satiety aspect, being able to fast for long periods of time and not even think about food, which ties into food addiction. So I definitely have a sugar addiction. Carnivore was very highlighting for me in terms of my personal experience with that, because I always knew I had a bit of an issue with sugar, but I didn't fully realize until I went carnivore and had absolutely zero preoccupation with food in between meals. So not even thinking about what the next meal would be or thinking what I would like to eat. And so that was a real eye-opener when I realised actually the sugar addiction had been much more prominent in my life than I'd even realised for many years.
Well, Rachel, welcome. It's good to have you. Thanks for rescheduling, by the way. I had a sort of a last-minute thing come up yesterday. So.
Oh, no, not at all.
And you are in the UK, is that correct?
Yeah, so I'm in Edinburgh in Scotland.
Oh, okay. You're in Scotland. Okay, very nice. I've been to Scotland once. I was in Inverness. I did a little Highland Games competition, get to run around with a kilt on, and it's at a World Championships a few years ago. I think it was 2014, I believe. But really nice place. Well, if you don't mind, would you just please share your background with us?
Yeah, sure. So hi, everyone. My name is Rachel Brown. I'm a consultant psychiatrist in the NHS. So I've been a consultant for, it's 11 years this month, actually, working in Scotland since I qualified from the University of Edinburgh in 2003. So I went straight into psychiatry training after my first year of kind of general surgery, general medicine training, and I've been in psychiatry ever since. I have a few other interests as well. So medical ethics was something I did along the way, medical law, but my primary interest is working with people of general adult age. And at the current time, I work within a crisis resolution home treatment team in Edinburgh City. And I've been doing that for about the past 6 years now.
And I'm sure, as you probably are aware, I mean, I guess mental health disorders are on the rise. I mean, I know they're in the U.S. and I assume probably worldwide where you're at. Is that fair to say? Oh,
yeah, I think that's fair to say based on the data, yeah.
What, and I guess I'm assuming you have, as most people that I interview, have sort of an alternate sort of philosophy or take on whatever they're doing. Can you go into that a little bit, perhaps?
What do you mean?
Well, I mean, you know, I guess like I tend to focus on nutrition as a physician, whereas most physicians tend not to. They tend to be just, here's a procedure, here's a pill. And I did a lot of that. I did so many, I can't tell you how many operations I did on people as an orthopod. Thousands and thousands of times I took people to the operating room. Not the same person, different people over and over. But yeah, so I mean, are you of the belief that nutrition has a role here in mental health disorders?
Oh, for sure, 100%. I feel quite alone. Obviously, I know that you had quite a high-profile professor from the US on last week. That was a really good interview. But otherwise, I feel quite alone in my discipline in terms of being of that view.
Yeah, Chris Palmer and I've, you know, and I think you're not totally alone, but you're certainly a rarity, at least from what I understand. And unfortunately, that's unfortunate to probably a lot of people. So how do you see nutrition impacting people's mental health? Is it the cause of mental health disease, or can it contribute to that? And does it have a role in perhaps mitigating or resolving it?
My personal view, and from reading of the literature and being in touch with quite a number of people now who've managed to put all of their symptoms in remission just using dietary strategies, my personal view is that it is the cause for many. I would say that mental disorders are multifactorial, so I think nothing's ever quite all black and white, very straightforward or simple. But I certainly think nutrition is at the fundamental basis for most, if not all, people when it comes to mental disorders. And that's certainly not what I was taught in training by any means. And that's certainly not a big part of mainstream Western medical practice. But I suppose I've come to that conclusion through other means. So I've had an interest in nutrition myself for many years now. I've also qualified in functional medicine, because it's something that really frustrates me in Western medicine, is it's just the easy solution to reach for a prescription pad and just papering over the cracks, really, and not really addressing the underlying root cause of illness, and for all sorts of conditions, not just mental health.
And I'm just going out on a limb here to reach, and I don't know if you have any insight into this, but you mentioned Western medicine, and that's the system I grew up and trained in. And there's others there's, I guess, Eastern medicine, or, there's a whole, and I don't know, is there some belief that food has a role in mental illness in say, Asia or other parts of the world where they look into this? Have you explored that at all?
I haven't explored it in a huge way. I suspect there will be. I've got very limited knowledge of Chinese medicine, so just through Chinese acupuncture that I've had myself, and actually my dogs I take to a holistic vet, which it's been a really interesting experience, because I think there are a lot of parallels in the veterinary world between mainstream veterinary practice and holistic veterinary practice. But the vets I go to practice a lot of Chinese medicine as well as other herbal medicine. And I suspect, but I don't know for sure about Eastern medicine, but I suspect energy and nutrition probably factors in more to their thinking about things.
What do you, in your practice, are you focusing on any particular areas? And I know within psychiatry, there's going to be people that specialize in certain disorders or patient population. You said adult medicine. Is there any sort of group that you see more often of?
Not really. So the crisis team I work in, we see anything and everything. So it's people generally over the age of 18 to about 65, although the goalposts are moving a bit with that in the last few years. But it's all sorts of people. So sometimes it's just difficult life circumstances. So it might not actually be a diagnosable mental illness, but it's more distress, suicidal thoughts that we're dealing with, psychological distress as a result of whatever life circumstances may be, all the way through to agitated depression, psychotic episodes, schizophrenia, bipolar, personality disorder, you name it.
So you said crisis. Are you doing a lot of inpatient care then, or do you do outpatient, or both?
No, so no inpatient. So our crisis team is an alternative to hospital admission. So the team was formed 12 or 13 years ago now, and it's when they reduced the bed numbers in our local hospital. And there's been quite a movement in the UK, I'm not so sure about America, but to try and treat people at home as an alternative to hospital admission. So yeah, generally, it's ideal if people can stay in their own environment and not have to go into hospital, because no matter what people think, I think there's a lot of variation between countries about what the actual inpatient environment is like, and it's not necessarily as therapeutic as people might be led to believe.
Yeah, and well, I mean, certainly in the U.S., I mean, it's all about, it's kind of cost savings for sure. I mean, they were trying to chase people out of the hospital within 24 hours of a knee replacement when I was, and they've been able to do that in a lot of ways, and many people prefer to be at home for sure. There's no doubt about it. But sometimes that home environment is what's causing the problem in the first place. They go back home to their their stress, their garbage diet. How often do you see? I know Chris Palmer noted that a fairly high coincidence or association between poor metabolic health, whether it's metabolic syndrome, diabetes, prediabetes, and a whole host of mental disorders. Is that the same thing you're seeing?
I would say so, yeah. I mean, metabolic health is pretty appalling when you look around just the general population. So, I mean, I don't know how many times I've been in people's homes doing home visits, because that's what we tend to do in my job. And there's just packets of crisps or chips lying around and bags of sweets, and or people are living on takeaways. And that's just the patients I see. The hospital staff that I work with is an entirely other manner. So yeah, there's usually junk food lying around in the office, and most of my colleagues, when I look around, have less than ideal diets. I would say that's my opinion. I don't voice it to them directly, but that's my take on it.
Yeah, I don't see the medical profession as a role model for how to eat. When I was in the hospital, there was an enormous number of hospital employees that were obese. there were nurses or some physicians. I mean, it was quite unfortunate. I understand you have a book out now on this topic, and I think it's called Metabolic Madness is what you've got out there. Can you tell us a little bit about that book?
Yeah, sure. I just really wanted to write something that kept things fairly straightforward. And it was really all the stuff that I wanted to tell patients that I don't always get the opportunity to do so. So it was partly for my own CPD as well, just it helps me to get things down on paper. And I ended up just writing a book to try and cover some of the evidence that's out there linking metabolic health to mental health outcomes, and then talk a bit about the different diet strategies that people could adopt. Because I think there is some variation. So I don't know that absolutely everyone needs to be carnivore 100%. Because I know of people who do well on keto, and some other people where it's been just particular foods they've ended up having to cut out, even if they've gone paleo or close to keto. And sometimes food intolerances can be an issue too.
Yeah.
So I just really wanted to write something that would be a fairly straightforward read for people. And actually, there's a few of my nursing colleagues who've been reading it, so that's nice to get some of their feedback.
Yeah, there is. I 100% agree. Not everybody needs to be on a carnivore diet. It has been helpful for many, many people, and some people choose to remain on that. I've chosen to remain on that just because I feel better that way, but I think it's not necessary for many people, although there's some people where it just seems to be the right answer. Do you find that there is I don't know, can we say, are there problematic type foods that seem to exacerbate mental health illness? Is it sugar? Is it processed, refined junk food stuff? Is it, I don't know, is it too much fat? Is it, what do you think you're seeing?
So I would say it's sugar, processed foods, and seed oils. And often they all go hand in hand, don't they? There's not much processed food on the shelves that you can look at that doesn't contain fairly inflammatory seed oils with their very bad omega-6 to omega-3 ratio. But I don't know, food addiction is another interest of mine. I think from a personal health journey, as well as anything else, and I see a lot of it around me. Patients and colleagues alike. So I think there are issues on all counts, but I don't think it's to do with fat unless you're talking about seed oils specifically.
When a patient is admitted for whatever, a psychotic episode or something where they can't be safely managed outpatient, what is the diet they're typically given? Is there any consideration to diet? I mean, if they have allergies or maybe they're diabetic, but is it just kind of junk food, or what do they typically get in the hospital?
Yeah, so I feel quite blessed that I don't actually work in the inpatient unit. But from what I know, people fill out questionnaires when they come into the ward, and there are certain options, such as halal foods or vegan, vegetarian options. From what I do see, though, menus that get emailed around the mass distribution lists in the hospital, it's mostly junk. So it's mostly carbohydrate focused, grain-based foods, desserts. There were emails flying around at work just last week or the week before, where the kitchen had put out that they'd had to have a last-minute menu change, and it was, I don't know, sponge pudding had been substituted with trifle, or those are the kind of examples. And then the staff canteen at work, I just never go to, but the menu there is just as bad. It's all paninis, chips, and fish and chips, battered foods, grain-based options, all very carbohydrate focused.
And I haven't heard the word trifle in a long time as dessert. My mother used to make that. She was, basically she was South African, and they had that influence in there, and so I hadn't thought about that in a long, long time. So. Mom, if you're listening, it's interesting. You mentioned vegetarian, vegan options, and there is data, a number of studies now showing a relationship between plant-based diet and mental health disorders, and whether it is a result of or those people tend to choose that particular dietary lifestyle. Any experience of your own which would corroborate or refute that observation?
I haven't done an audit, for example, of specific patients that I've seen. I don't have a clear sense that I'm seeing more people who are vegan or vegetarian who then have mental health problems, but I am aware of the association and the research. I tend to tell people when I have the opportunity that I don't think that's the ideal diet in terms of their mental health. I have some personal experience of that myself because I was vegan for a relatively short time and quite a number of years ago now. That was probably it was the worst health decision I think I've ever made.
Why do you say
yeah,
why do you say that? Why was it the worst health decision you'd made? Was there a problem with it?
For several reasons. So first of all, the only time I've ever had flu in my life was when I was vegan. So I was vegan for 18 months, and that was about 11 or so years ago now, something like that. I was really ill with the flu back then, and quite considerably younger than I am now. Since going carnivore, I just don't get sick anymore with anything really. Okay. That's been 3 years now. So that's been very eye-opening for me. I think from a body composition point of view, when I was vegan, things weren't good. So I remember feeling as though I was putting on weight and losing muscle, and just I didn't put on a huge amount of weight, but just felt the muscle definition wasn't there, and just felt kind of soft. And I was aware that I had body composition changes that weren't healthy. And then from a satiety point of view, that was the other thing for me. So I just felt hungry all the time.
Yeah, I didn't So I didn't realize you were doing a carnivore diet. So it's interesting, and maybe I'll chat about that a little bit. But I want to ask you, there was a recent paper came out looking at serotonin. I'm sure you saw that, where they saw that the thought was that an imbalance in serotonin levels, and that was a justification for the SSRIs, which are incredibly widely distributed and prescribed times 20 or 30 years now. What do there are people say, well, maybe it's not because of a serotonin imbalance, but these drugs still may have some efficacy. And you mentioned inflammation. What do you think is going on? And I know it's still speculative because I don't think we really know. What do you think is going on physiologically with some mental health disorders? I don't think you can put them all in one basket, but do you have any thoughts on what might be going on physiologically?
Yeah, just putting antidepressants to one side. Do you mean?
Well, I mean, as far as, like I said, there's theories on what causes mental health disorders. Is it a profound trauma? Is there some sort of neurological or neurotransmitter imbalance? Some people think it's inflammation. Some think it's a nutrient deficiency. I don't know. I'm just trying to see if you have any perspective on that.
Yeah. So there's a lot of evidence that it's metabolic dysfunction in terms of insulin resistance. So most, if not all, mental health disorders are higher rates of insulin resistance, and that's even controlling for medications that cause insulin resistance in their own right. Kind of repeatedly spiking your blood sugar levels, we know causes inflammation. So I do think of all mental health disorders as inflammatory disorders fundamentally. I think gut health is really huge when it comes to mental health. And I think there's a lot of research yet to be done there, but that's a particular area of interest of mine. Probably from a functional medicine training point of view, because we know that neurotransmitters all originate in the gut. It's the bacteria in your gut that produce these things. They produce various neuropeptide chemicals. There's a clear connection between the gut and the brain in terms of the gut-brain axis that some people refer to, with both physical connections, the vagus nerve, kind of neurological connections, but also the more chemical signaling that goes on. And that's bidirectional, so that goes from brain to gut and vice versa.
As part of your practice, do you investigate those relationships? Is there you mentioned inflammation? I mean, high sensitivity C-reactive protein might be one I would think. Do you ever look at those relationships and see how they pertain to mental health illnesses?
So routinely, that's not a general part of practice. I tend to try and screen for a CRP when I'm taking bloods off somebody. But beyond that, we don't do any microbiome testing or anything more investigational or experimental. Some people might view that as. It's funny. I did the training with Georgia Eid a couple of years ago. So using ketogenic diets for clinicians training, and as part of our education and continuing professional development, we have to have approval from a peer group. So I meet with a peer group of other psychiatrists every few months, and we all approve each other's professional development. And I remember at the time when I said I wanted to do this, there were several psychiatrists who were quite supportive, and one in particular who sent an email saying, well, that's fine this time, but maybe next time you can concentrate on something more mainstream. And that just amused me. So I answered him on that email. But there's quite a resistance out there to think that metabolic health and diet would have anything to do with mental health. There's a real disconnect.
Outside of your own experience with diet, and I think it's important, it does shape a lot of us. That's what shaped me. I mean, I would have never done this had I not seen a profound change in my own health through diet. Are you seeing patients that you are treating? Are you seeing some response to when you can convince them to try changing diet? And I don't know how often that you are. Some people are very resistant to do that. But do you see results with diet?
So I haven't seen a huge amount, but that's partly because of the area of the service where I sit in. So when I see people, they're usually acutely suicidal or in an acute crisis, and it's not a great time for somebody to be making a big overhaul of their diet. I remember speaking to George Eade about this when I did the training. I have had a few people pick up on the diet and start doing it, but then I don't follow them up for long enough to actually see what the results are. I did have this one lady who had a late onset schizophrenia, so she developed psychotic symptoms around the age of 60, and she did agree to do the keto diet, but then it was a week or so before she had to go into hospital, and then that was that, and I didn't have any more contact with her beyond that, and so I think she came off it and then went on to more heavy duty medication. So I don't have any specific results that I can speak to just myself, but a lot of that's to do with where I sit within the service I work in.
Do you see any capacity to change that where you're at? Is that something you think you have the power to do, or is it just the system just not built for that?
I'd really like to explore the option of developing a metabolic psychiatry clinic where I am. So I just recently became involved in one of the keto clinical trials that are ongoing, looking at keto diets and bipolar disorder, and thankfully there is one in Edinburgh. And I know some of the researchers in that trial are hopeful or aspire to developing something locally in terms of a clinical service. So that's certainly an interest that I would like to pursue further. So there might be some opportunity there. I think otherwise I'd be thinking of having to go into private work. And I've had a few people contact me via social media or finding me on the internet wanting to speak to me, and ethically, I do feel bad at times that I'm not doing any private work and nobody has access to a psychiatrist locally who'd be willing to work with them on diet. And so that's something I'm wrestling with at the moment.
Yeah, it is a challenge. I certainly, as someone in has spent a lot of his life in the sort of mainstream healthcare system, the facility to do this is very challenging. It's not available, and it's there's no. You can't have any compensation for it, or it's very difficult to get that. It's it's so much easier for me to just line people up and do surgery on them. I mean, that's the honest answer. If I wanted to make a decent income, that would be the easy way. And it's challenging, and most people don't want to. They kind of like that it's easy to do that. Do you find that what was I going to say with this? Do you have any other people in your community that are, you mentioned the few physicians that were kind of supportive. And does anyone else around you sort of agree?
Not really, but I think, so there aren't that many consultants where I work with locally who I've had big conversations with about this. It's been more nursing staff that I work with, because they're the people I spend the most time with. I think a lot of people are open to the suggestion. I work with one other consultant colleague in my team that we work with, and I know that he's just recently bought my book, and he was having a few health issues of his own, and I'd spoken to him about, it was more in a jokey manner, just casual conversation, so saying, oh, maybe you need to think about low carb. And then he'd been out having his response was to show me he'd been out for dinner with his wife, and they'd been at a posh restaurant somewhere, and I don't know if you're aware, but a dish over here is people deep frying Mars bars.
Mm-hmm. I've heard of it. Yeah, I've never had it, but yeah.
Yeah. So anyway, we had a laugh about that, We still do. So I don't know. I think it'll just take a bit of time to have more in the way of conversations. But I hope with some research that some clinicians might open their minds to the possibility of the importance of metabolic health, mental health.
Yeah, and obviously you've chosen to pursue a carnivore animal-based diet, so my assumption is that works better for you. Do you think there's a difference do you think animal-based nutrition is superior for metabolic health or mental health?
Absolutely, yes. Certainly in terms of protein bioavailability, but also some of the nutrients you just can't get in plant-based foods. So think about DHA and the importance of that in brain health. But then, I think I heard it was probably Paul Saladino talking about it recently, or it could have been yourself, Shawn. Don't want to conflate the two, but I'm sure there are lots of nutrients within foods that we still don't know about or have names for. So I think there's so much out there that's unexplained. But certainly for my own health, going carnivore was just the best health decision I think I've ever made. It's been just night and day for me for the last 3 years, and I wasn't even aware. I didn't really have any major health issues from my point of view. I did it partly out of curiosity, but I don't see myself straying from that because of the health benefits I've had.
It's interesting how some people, it just works so well for them and they feel so good, and we're kind of told, well, we shouldn't let people do that, or as a physician, that's sort of dangerous, or somehow we're supposed to police what people eat. And I think that's an unfortunate type of thing. I think when I think about all the nutrients, and you mentioned we don't even know some. I know that research on beef and other animal products indicate there's literally thousands of compounds, if not 50,000 plus, as per the work of guys like Stefan von Vliet out of University of Utah now, but formerly of Duke. So we have a lot of things in there, and we know some of the things like carnitine, creatine, taurine, carnosine. All those things have impacts on brain physiology and mental health that we don't even really explore that much. I know there's a study out of Stanford where they looked at major depressive disorder, and they saw that people had there's a pretty significant correlation between low levels of serum carnitine and major depressive disorder, which carnitine we can make only endogenously to a small degree, but it's still going to be low unless we take it in the diet, and we get that through meat in particular.
I'm just wondering how we're ever going to get the research for any of this, though, because there's not really going to be a drug company or a big fund of money that's going to invest in any of it.
Well, you're right.
My word.
I think some of it's going to be grassroots, and like I said, I know we're committed as a company to do some of that research. We can't do it all, but and there are some individuals that have done some of this research. We're seeing a few studies start to trickle in. I suspect as this, I think it's going to be a ground up sort of grassroots type of thing as more and more and more people are experiencing what you and I have, and the many thousands of others now, that it's hard to continue to pretend it doesn't exist, that type of thing. Mm-hmm. What is you mentioned you're doing a carnivore diet, so what does that look like? Has it evolved over time? How did you start? How was the transition? Did you have problems with that?
Yeah, so I was keto for a good couple of years, I think, before I transitioned into carnivore. I hadn't heard of carnivore at all and came across it via Vanessa Spina,
mm-hmm.
A ketogenic girl, because I like some of her plans that she does for keto. And when I first heard about it, I thought it was absolutely crazy.
As did I.
A lot of people do. And then I thought, well, if Vanessa's doing it, she knows her stuff, so there must be something in it. So then I watched Michaela Peterson talk about her health journey, and then it was actually a video on YouTube of yours. So I think you were speaking at CarnivoreCon in 2019, and there was an analogy you used that just really hit home to me. And I think it was either the state of nutritional research or dietary guidelines, but you used an analogy of a plane. I don't know if you remember that.
Yeah, I remember it. Yeah, sure.
Yeah. So that's what convinced me. And I just thought, right, there's something in this. I need to try that out. And I'm a bit of an all or nothing person. So it was kind of next day, just decided, right, this is what I'm doing, and no looking back. And I had transitional symptoms for, I think, around about 5 weeks on and off in terms of GI type symptoms. And in retrospect, that really, I just find that fascinating, because I conceptualize it as there must have been quite a big shift in the microbiome that was happening in that time, as well as adapting to having less fiber and so on. But I tend to think it's probably got more to do with the microbiome, because I had been keto for a couple of years and I wasn't really having a huge amount of fiber, and I didn't think it was going to be such a drastic change, but I definitely did have transitional symptoms. I think I had a little bit of a meat aversion at the start, so I didn't start off in the right way. So I started off not knowing what I was going to take to work for lunch in the beginning. So I ended up buying some deli type meats and then eating cheese for fat. And it just took me a bit of time to work out what was the best regime for me. So I've kind of settled out at 2 meals a day, primarily beef. I eat bacon. I eat a lot of ground beef or minced beef. I love ribeyes. They're my favorite steak, but they're not a staple in the household by any means. That's what I'll have if I go out somewhere. But and then it's been a bit of a process of learning as well, and I'm still learning, I would say. So in terms of dairy, I think I used a lot of heavy cream in the beginning as well, and I don't think I tolerate pasteurized or cow's dairy all that well in retrospect. So that's just something that I'm playing around with now and again. But I've discovered I don't really like chicken so much, or the other proteins that I probably would have focused on in years gone by. It's just really interesting how your palate and your taste change. But it's definitely red meat. That's where it's at, I would say. That's what I crave for, and that's what keeps me fullest for longest. And I eat eggs as well.
Yeah, it's very similar to my diet. I mean, my diet is basically at this current time, it's pretty much just steak and eggs every day, twice a day for the most part. It's interesting how most of us sort of gravitate towards red meat for whatever reason. It's just what naturally gives us the most satisfaction and perhaps is the most nutritious, when we listen to our own bodies as to what we want. So it's kind of an interesting process indeed. Do you have any family that has noticed your sort of transition from a point where you were plant-based to now fully meat-based, and any sort of like you're going to kill yourself type of concerns, or what's the dynamic like?
Yeah, so I'm married. My husband's a psychiatrist as well, actually, and he's a type 1 diabetic. And I've got a son who's 9, and then my mum's around as well. She's a bit more of a skeptic when it comes to this. But yeah, my husband, he went keto, oh gosh, I forget now when it was, a couple of years ago at least. Just randomly one day he said to me he didn't want to have any more rice, and why was he doing that? He was just going to lower his insulin requirements. And now he's probably about 90% carnivore. And that's been really, really interesting. So he doesn't get the cognitive hypos that he used to get. So we always had this running joke that, I remember when I first met him, he said, oh, if you're getting angry with me, I should know that I'm hypo, because he tends to just not be thinking, not able to think properly or think straight. Sometimes when he used to be hypo, that just doesn't happen anymore at all. So I can't remember the last time that he had a hypo like that. And his blood sugar is pretty much flatline, being about 90% carnivore. And even when his blood sugar is slightly low and he has to compensate with something to eat, he still doesn't get the cognitive hypos that he would have had previously, because obviously his brain's running on ketones.
Yeah. Yeah, that's interesting to see that, particularly around the hypos, because that's one of the concerns, and many endocrinologists would prefer you to run high than low, because they're worried about, you can have a severe hypoglycemic crisis, which could produce, seizures and whatnot, and perhaps death. So that's obviously one concern there. And I think they're just, but I mean, it's interesting how once you have that steady source of, non-glucose related fuel, you can sort of weather the lower glucose storms without the physiological hypoglycemic effects. And so that is interesting. So no pushback from the family.
No, I mean, no, my mum just, all she says to me is, I couldn't just eat all meats. And I say, I am not asking you to. I'm just asking you to eat a bit less of the processed garbage.
Yeah, and that is the thing, as people will say, well, I couldn't do that. Well, so that's fine. You don't have to. No one's demanding that you do that. We're just putting that out there as this is an option for people that care to choose to do so, and it has shown pretty good efficacy for a lot of these conditions here. Did you notice, the overall effects when you mentioned body composition and, I can't remember if you mental performance, I can't remember what you said was improved by the dietary shift.
Yeah, so for me, definitely body composition. So I've said this to some of other people, but within the first 2 weeks of going carnivore, I remember looking in the mirror one day and thinking, wow, I'm getting more and more abs. So obviously I was losing visceral fat. That was obviously there even on keto. It's much easier. So I could do more push-ups within a week or two of carnivore than I've ever done in my life. I just found that my strength's a lot better. I've been able to build muscle. So I've been using the X3 bar for the last year and a bit, maybe about 18 months. I really love that, actually. So that's been a difference. And then my other main difference has been, well, two others. So the satiety aspect, being able to fast for long periods of time and not even think about food, which ties into food addiction. So I definitely have a sugar addiction. And carnivore was very highlighting for me. In terms of my personal experience with that, because I always knew I had a bit of an issue with sugar, but I didn't fully realize until I went carnivore and had absolutely zero preoccupation with food in between meals. So not even thinking about what the next meal would be or thinking what I would like to eat. And so that was a real eye opener when I realized actually the sugar addiction had been much more prominent in my life than I'd even realized for many years. And then otherwise it's immune health. So I used to get sinusitis, and not all the time, but now and again, and just common colds and feeling run down. And I just don't get any of that. So the most I would get now would be, I've had maybe 12-hour periods where I thought, oh, am I developing a bit of a cold? And then it just goes away, and that's that. And so that's been one of the biggest benefits from my point of view. And I was going to say my 9-year-old son, he's eating a lot more meat these days. And I have to say that he's no longer, I can't remember the last time he was actually sick, whereas when he was younger, we would have had quite frequent episodes of high temperature and various illnesses.
It's interesting. I remember some people that would just get constant recurrent sinus infections, and they're always constantly on, this and that antibiotic, and sometimes end up with sinus surgery to deal with that. And it's interesting to see how nutrition plays a role, and it would make sense. I mean, our immune system is impacted by our nutrition. Clearly, it must be, just like everything else is. And so, very, very interesting. Do you find what is you said you're in Edinburgh, and what is the climate in Edinburgh as far as, is it becoming a vegan capital? Is it still pretty traditional where people still eat sort of meat and eggs and dairy, or what's the vibe there these days?
I think it's a bit of a mix. So you definitely see veganism on the rise. So there are more vegan restaurants or vegan options in restaurants than when I was vegan all those years ago, definitely. Having said that, people I know firsthand, I don't really know many vegans. So there's one or two that I've worked with, come across through work. But otherwise, I think most people tend to include some sort of meat in their diet.
Yeah, that's that is, and again, I think you see more of them. I don't know. It seems like, as far as in the real world, I rarely run into them. Maybe they probably don't want to associate with me, but I find that this sort of the amplifications being there in the media, I think, is somewhat fabricated in a little bit. It's almost as if we have these sort of polls that aren't really realistic, and they try to sort of get everybody to jump on the bandwagon when no one's really there yet, or maybe ever be there. Have you had any thoughts on sort of I don't know if the Scottish guidelines are mirroring the U.S. or the U.K. I guess it's part of the U.K., so I guess it would be. But do you have any concerns with what they're telling people to eat?
Oh, for sure. So the food pyramid, I just think, is all flawed and wrong and upside down, essentially. I I don't know that there's actually a separate one for Scotland. If there was, I probably wouldn't really pay any attention to it, to be honest. I get really angry when I think about the dietary guidelines, that came out in the 70s and the early 80s, and the impact that that's had on population health worldwide. And I think the UK has pretty much mirrored the US in terms of adopting those guidelines. So looking at the rates of obesity and type 2 diabetes and various other disorders that follow on from those.
We have
that gets me fired up.
There are a number of studies that at least associationally relate lower levels of cholesterol with violence, suicidality, depression, and other mental health disorders. Do you ever notice that or see that? Is that part of a normal intake, blood lipid panel? Is that ever done with people admitted for inpatient psychiatric issues or crisis interventions?
So we probably don't do blood tests as well as we should. In general, in psychiatry, I would say we tend to do more targeted testing. So if we're planning on putting people on antipsychotic medications, there are guidelines in terms of doing lipid profiles and testing again 3 months later. When trainees who come through training do audit as part of their training process, you invariably see that we don't do as well in doing blood tests as we should do. So yeah, I don't have any clear sense. I think I know what we would find if we were to test those things. But yeah, the reality of it's another matter.
Is that, in the U.S., when I was practicing as an orthopedic surgeon, I sort of thought, well, I'm interested to see what the insulin level of somebody with, say, carpal tunnel was. Because my philosophy was, or my theory was, I think they're insulin resistant or something along those lines. I think this is contributing to it. And I did manage to get a few people tested, and it did show high insulin, but it was very challenging to get those tests ordered because, why in the hell do you want an insulin? Trying to justify that. Do you face the same situation in the UK where you have to, say, jump through all these hoops to get a lab test ordered?
Yeah, absolutely. I was just thinking, I was just laughing internally there about the trouble I would get into if I started trying to request all of these tests routinely in my day job. To be honest, I don't even know if anyone does routine fasting insulin testing on the NHS. I suspect they don't, even in diabetic clinics, and looking at people with pre-diabetes. So I think it's a strong view, but I think it's all done wrong and could be done a lot better than it actually is. Essentially, they just do random glucose tests and an HbA1c sometimes, and that's the limit of it.
Yeah, it's well, there's a lot of potential problems with that for sure. Do you so as part of your so let me ask you. So there's a number of medications out there that people use: antipsychotics, antidepressants, mood stabilizing medications, on and on and on. Do you see problems with a lot of side effects from that probably could be avoided if you could manage to get a dietary shift? And what are the typical? I know things like loss of sexual function, weight gain, cognitive blunting, and things like that. What do you see as often side effects with some of these medications?
Oh yeah, so probably the most commonly seen side effect is weight gain and metabolic syndrome that people get. So and diagnoses of diabetes. I suppose I'm typically thinking of the antipsychotics there, but then there are a lot of patients I see who gain weight on antidepressants as well. So I suppose all of the insulin resistance related issues, that's what I see. But of course, sexual dysfunction, sexual side effects are very common with antidepressant prescribing. To be honest with you, my ideal would be being able to work with people along nutritional lines, so nutritional therapy and actually de-prescribing for people. That's where my heart is in terms of where I'd like to go. And I suppose that's partly what metabolic psychiatry should be about.
And I think that hopefully you'll get to do that. So let me ask you, because there may be people listening to this that are on some of these medications and they don't want to be on them, and they may be tempted just to quit them cold turkey. Can you talk about how somebody, if you had a patient in front of you that wanted to wean off various medications, how would you do that? Say you're incorporating an improved diet. How should people do that?
So gradually, so there's no great rocket science to it, but just gradually reducing dose. So usually with medications, there are incremental dose reductions that you can do. I see Brett's commenting there, very gradually. So some of the antidepressants, in fact, a lot of them come with complications of withdrawal symptoms as well. There's a group of critical psychiatrists in the UK. So Joanna Moncrief is a professor down in London, and she was involved in the recent publication that made a lot of media outlets in terms of saying that serotonin doesn't really have anything to do with depression. She would, her books are really interesting. So in them, she talks about rebound psychosis and rebound illnesses when people stop medications too suddenly. And I suppose raises the question as to whether what we see in clinical practice is actually a rebound illness after people stopping medication suddenly. Because I come across that every day in my practice. So we see people with recurrent episodes of psychosis who become unwell again in the typical pattern of symptoms that they've had before after they've abruptly stopped their medications, and then we restart them and they get better, and then off they go into the sunset, and everyone says, oh well, all they needed to do was take their antipsychotic. But I think that's overly simplistic, and I think there's a lot we don't know about what's actually involved in keeping somebody well and getting somebody better. But certainly in terms of coming off medications, just very gradually. And obviously, I have to say, and the ideal to say is discuss it with your doctor and agree with them to make reductions. But obviously, not all doctors are reasonable people. I know that we're only human, so people may need to look around if they need to find somebody who's more willing to work with them and troubleshoot difficulties that may arise, may or may not arise. Because I know a lot of people do manage to get medications down and get off them. And the withdrawal symptoms seem to be quite variable. So some people experience a lot in the way of withdrawal symptoms and others not so much. And there's a lot of bioindividuality and a lot of stuff we don't know about the genetics as to why that happened.
Do you have any relationship with something called the Public Health Collaborative UK? Are you part of that? Are you familiar with them?
I'm not part of that, but I'm a big fan and follower of Asim Malhotra there. So I will be following their work, definitely. Yeah,
I think I'm going to meet with Asim when I'm in London here in the end of this month, and so maybe some of the folks from that group, I believe. But do you is I guess Scotland would fall into that, right? I mean, it's part of the UK, so I mean, you could certainly be part of that particular group, and I don't know what kind of support. I know I don't know how many practitioners they have in there. I know David Unwin, Asim Malhotra, and several others that I've talked to over the years are part of that. I don't know how big that group is. Is there, in the United States, medicine is very often very much privatized for the most part. So it's a very much a profit-driven system, and the profit comes from, quite honestly, through payers, through procedures, and we get a lot of money for cancer chemotherapy, a lot of money for doing surgeries, cardiac interventions and stuff like that, and then some of the other professions like psychiatry tend to be money-losing operations. Pediatrics is a money-losing operation for the most part when you look at a hospital. Do you think there's enough financial system incentive within the NHS to save the money to where something like this could actually be implemented? If you had, maybe you could get enough like-minded physicians to say, hey, if we institute nutritional stuff. It's interesting, I had a guy who I talked to recently who bipolar, I think was he bipolar? Yeah, bipolar disorder, and been hospitalized something like 200 times. He's one of the high frequent flyer type people that's always going to the ER, and how much money that costs in the United States. It's hundreds of thousands of dollars a year. And I was just thinking it would be almost cheaper just to feed you ribeye steaks every day from a drain on the economy as far as treating these folks. And if we could just put the money into feeding these people a good diet, even subsidizing it, it might be a huge net win, particularly for people like that. But do you think there's any realistic chance in the NH system that it could be done?
I don't want to be pessimistic, but I don't know. I'm not sure. I think there would have to be a lot of fairly senior people in the organizations invested in making a change that way. I mean, obviously you can start with small changes that can then generalize or spread across services. But I think there has to be a lot more in the way of more senior kind of colleague support for that. And yeah, the money in the NHS is another thing. So I think more in the way of healthcare in England is privatised than in Scotland even. But I do know of even just local psychiatrists who had been practicing privately. It obviously hasn't been much of a moneymaker for the private clinics, because I know they've had to leave or they've stopped funding for psychiatry specialties. So with a preference for surgery and other interventional, procedural-based medical appointments.
Let me ask you I'll have to ask this question since it's from Scotland. Have you ever had haggis? And, I guess maybe as a carnivore, maybe you might not eat it. Maybe you could make a carnivore version of haggis. Have you ever had that?
Oh, yeah, years ago. Not for years, though. That was just a rite of passage in childhood, I think, growing up here.
For those
somebody in the audience is saying they love haggis. Okay. I'm not the biggest fan, I have to say. Yeah. For
those that don't know, it's a bunch of ground up stuff put inside of a sheep's stomach and served. I've never had it. I don't know that I would now, quite honestly. But I guess if you took all the oatmeal and the other stuff that's often put in there, maybe you might try it. But let me ask you back to your book. What is if somebody were to read your book, what are they going to find within the book? What are you talking about? Yeah, is it the physiology, or what's the flavor of the book?
So it's an overview of the studies that are out there in terms of linking metabolic health to mental health, insulin resistance, inflammation, everything I said before. But I draw on my functional medicine experience and try to link together gut health and the importance of that. So really just trying to show people that there's quite a lot of evidence out there that suggests metabolic health is key for mental health, and that we should be paying more attention to that and investigating that more and looking at diet as an option. I suppose my mind was open up to all of this, and particularly carnivore, because of Brett. So Brett Lloyd. So I remember the first day that I asked him a question on Instagram when he was posting about his recovery from mental illness, and I also point out to people that there are lots of people out there who've recovered from a variety of mental disorders. So I suppose, yeah.
Yeah,
it's quite a quick read. So it's like 2 or 3 hours, I would say it would take most people. And I'm just trying to not make it too medical jargon filled, and try to explain some of the research that's out there, and then a bit of my personal views as well.
Yeah, it is interesting, and I've chatted with Brett many times, and he has inspired a lot of people. It's nice to see that he had an impact on you as a physician as well, which I think open-minded physicians should be paying attention to their patients and learn, and they can learn a lot from them, and it shouldn't all come from the inside of a drug, a drug pamphlet. Just out of I just put this out. I just found this out. Haggis is banned in the United States. We're not allowed to have haggis here, and the reason for that is because it often will contain sheep's lung, and that is considered not edible for human beings in the United States. So I didn't know that. So it's interesting. Okay, Rachel, thank you so much for being here. I've got to, unfortunately, go run and do some consultations of my own. Tell us, once again, where they can find the book, where they can find out more about you. If you have any social media that you want to share, please go ahead and do so.
Sure, yeah. So the book's on Amazon. I think it's available worldwide. I was actually thinking of adding something else into it in the next week or so. So people might want to hold off, but even people who've bought it already, I'll put it on promotion or try to offer it free somehow so that people can get the updated version. Just I wanted to put a bit more about Alzheimer's disorder in there, which I've done since. I'm on social media at Carnivore Shrink is my handle on Instagram. I have a website as well, but I'm not so active on that. So I would say Instagram is probably the place to find me.
Okay, so you're the Carnivore Shrink, because I see you occasionally commenting on some of the stuff I put out there, so I'll have to go find you, find you and follow you there, since I know who you are now. So, well, thank you for being here, and also thank you for being willing to swim against the stream, like many of us are doing. I think the more of us that do this, the better we can impact society in general. So thanks again. And the rest of you guys, thank you. We'll be back tomorrow. Rachel, have a good evening there in the UK, and I look forward to visiting in a couple of weeks. So take care. Bye-bye now.
Oh, excellent. Thank you. Thanks for having me. Bye.